Today we're looking at facial aging. What happens with face and neck lift surgery and what results in a natural appearance? What is a natural appearance? Now, facial aging, well, there are really three aspects that affect all of us with time. Gravity, loss of volume, and we get loose skin, laxity. So what is important to keep things looking natural? In other words, how do we avoid like a done appearance? My name is Dr. Julian De Silva. I'm a board certified facial cosmetic surgeon, and my practice is in central London in Harley Street. And I specialize in only facial procedures. So this is a patient who came to see me for revision facelift and neck lift surgery. And what we can see in terms of facial aging, well, there's like these kind of folds, these shadows, these are termed the nasolabial folds, there's kind of shadows around the lips, the marionette folds. We can see that there's a slightly tired appearance to the eyes, they're slightly droopy. We can see changes in the neck, there's a band in the neck. There's a general tiredness about this individual's appearance. Now, there are three universal aspects of aging that affect all of us with time. Descent, gravity, and we can see that in this area, well, there's descent around the eyelid, which creates fullness around the eyelid area. There's deflation, loss of natural volume, and sometimes we can see that in the cheek area as almost a shadow in a person's cheek as the volume comes down. And then thirdly, there's loss of skin elasticity. The skin gets looser, and people often notice that along the jawline and the neck. You can almost pinch loose skin around the jawline or pinch skin under the neck because of the loose skin. Now, in terms of descent, well, as everything drops, what we notice is jowls, this fullness along the jawline. And in addition to that, the descent creates deeper folds, the nasolabial folds, and deeper folds here in the marionette area. And as this descent comes down, it creates more fullness in the neck. And part of that is laxity in the skin, but there's also prominence of the fat. And often there's also like the neck muscle, which is like a sheet in this area, the platysma. Well, you can see this as either one or two bands in the neck. And then the third element is deflation. We know from Rod Roddick and John Pess's scientific papers on facial aging, there was loss of volume in very specific pads of fat in the face. And this can be termed deflation. And volume can be restored either non-surgically with fillers, surgically with fat transfer, or sometimes implants can be helpful in order to restore greater amounts of volume. So going back to my patient, well, now taking slightly different angle views, we can see that there's quite a lot of facial aging from gravity. As this area of her face has come down, it's deep in the nasolabial folds, it's deep in the marionette lines, and there's this kind of laxity in the neck area. Around the eyes, there's been drooping of the tail of the eyebrow, which creates more fullness in the lateral part of the neck. And then finally, as this gravity comes down on the side profile, we can see that it reduces the smooth contour of the jawline. We can no longer see the jawline and this fullness in the neck. Now, I quite often use the golden ratio to analyze the human face, because what we can do with the golden ratio is we can specifically measure certain elements and parts of the facial characteristics, and we can correlate that and look how these areas have moved with time, and we can use the golden ratio to do that objectively. Now, this patient of mine, well, she went on to have like revision facelift surgery, and my technique that I've customized over like more than 10 years is a vertical deep plane facelift. And what that does is restore the anatomy upwards, vertically, to where it used to be, and that results in a more natural appearance. It tends to result in less swelling, and finally it tends to last for longer. Most facelift surgery tends to be focusing on the smaz and lifting towards the ear, and although that surgery is much faster to do, it doesn't improve the facial lines as well because it's not lifting, and it tends to require other treatments to restore volume. Now, in the neck area, we can see as this area is lifted upwards, what happens, it creates more of a contour of the V-shaped face, and that is a V shape that we often see in the jawline in youth. It's restoring your natural jawline. We see more of the angle of the mandible where the jawline lies, and that is lost with time. And finally, the scars can be hidden around the curves around the ears and behind the hair, making them very discreet. I don't like scars that come in front of the hair or shave any of the hair, so it's much better to use more discreet scars, beveled incisions, and I have a separate video on this. From the side profile, what we can see is, well, there's restoration of the jawline angle. And so sometimes in medical jargon, this is called a cervico, which means neck, mandibular, which means jawline angle. And that's really an angle of youth, because when that angle is restored, it looks more youthful. When everything is lifted vertically upwards, what that does is it lifts the marionette, it lifts the nasolabial lines in a way that older conventional SMAS facelift surgery is not so effective at doing. Well, the brow area, it comes down with gravity, the temporal brow, and as this comes down, it creates more fullness in this area. And part of this is related to gravity, part of it is related to deflation, loss of natural volume in the temple area, and then thirdly, increased laxity in the skin. When this area is restored with a temporal brow lift, and it restores its anatomy to its original place, opens up the eye area, which looks fresher and more natural. And I've shown this in an illustration. When this tail of the brow is lifted upwards, well, the hanging and laxity in the temporal area is lifted up, and that tends to enable you to see more of the outside of the eyelid that looks more open, it looks fresher, and it beautifies this area of the face. What about this area of the face? Now, the lower third of the face has a fat pad called the buccal fat. Now, this buccal fat can be more prominent in certain individuals, particularly if you have a smaller chin or certain anatomical features. The buccal fat seems to be more prominent, and it can also be affected by facial aging, gravity and descent, and it can result in a squarer appearance to your face, loss of that V shape. So this buccal fat can be very specifically identified with face and neck lift surgery, and what can be done I use a specific technique where I use the same scar from the face and neck lift surgery, so there's no additional scars, unlike conventional surgery, where that buccal fat can be reshaped and reduced. Now, we definitely don't want to reduce and remove all of the buccal fat, we just want to reduce the fullness of it so it's less prominent, and so less is more. And what that does is just a subtle contouring in the lower third of the face. The buccal fat, well, part of that is facial aging, part of the prominence can be genetics, and some younger people have a much squarer part to their face. Often they do also have smaller chins, in my experience. And then there's also this kind of V shape that is kind of lost, it becomes squarer. Now, if we contour that buccal fat, it creates more definition in the lower half of the face, and it creates a more attractive V shape to the face. And this is also can be described as beautification of the face. What about deflation? We know with facial aging there's a loss of volume. We know that these fat pads and they can lose volume. Well, what does that mean? Well, we can see in this patient of mine, there's loss of volume in the temple. There's thinning of natural fat. We can see prominence along the brow area where the bone lies. We can see the face looks more gaunt. And because of that, the skin is hanging down and these deep nasolabial marionette lines can be seen, and we can no longer see the jawline. Now, there's a degree of all the aspects of facial aging here, but loss of volume and deflation is kind of key in this particular individual. And loss of volume, it occurs with time. And of course, there are other factors, genetic, environmental factors, but as facial aging goes, we can see that there's a loss of fat in various aspects of the face with each decade. Now, with fat transfer, and the technique is very, very important in how this fat transfer is done, because less is definitely more. And smoothness of the fat, we don't want to see any lumpy, bumpy changes, so the technique is very important. We can take fat from very specific areas of the body where there's less fibrous tissue. We can use techniques to refine and concentrate that fat, sometimes using other techniques such as regenerative medicine to improve the survival of the fat. And then we can put that fat back into very, very specific areas. Now, it's only tiny amounts of fat, but if we put tiny amounts of fat into very specific areas, it restores loss of that natural fat. it rejuvenates these areas, and it's actually more than just adding volume. It tends to improve the quality of the skin. And so whenever I look at someone's face in terms of facial aging, sometimes in the context of face and neck lift surgery, I'll look at very specific areas, and if an individual has an old photograph, I can look and see how that person has changed with time and can add very specific fat in those areas. So in this patient of mine, well, she needed quite a significant amount of fat transfer just to soften the areas of facial aging, around the temple, around the eyes, the lower eyelids, the cheeks, the nasolabial and marionette lines, and just generalized volumization. Now, sometimes if there's just lacking certain bone in certain areas, implants can be used, and for this lady I used the chin implant just to restore and improve the harmony and facial balance by bringing her chin forwards. All of the illustrations that you've seen have come from my face and neck lift book, and this book is really written specifically for patients looking to have surgery. A number of different celebrities have had face and neck lift surgery, and some of those, Sharon Osbourne, Jane Fonda, Joan Rivers, they have gone on to describe how they've regretted some of cosmetic surgery that they've undergone. But certainly if we look at someone like Sharon Osbourne, looking at her before having surgery and after having surgery, well, maybe there's a little bit too much change in terms of volumization, but certainly areas of the neck, the jawline certainly were improved by face and neck lift surgery. There are other celebrities including Marc Jacobs, Kris Jenner, Cher, who have all admitted to having face and neck lift surgery and been happy with the improvements, some really delighted on their social media. The truth is, with really excellent facelift and neck lift surgery, it can actually be difficult for people to tell whether you've had surgery because the scars can be largely hidden in natural curves and creases around the hairs, behind the ears, and as long as you have little time for the majority of the swelling to go down, it can really look quite natural. And the key is, as I've kind of gone through with you, is to look at the detail, because all of the millimeters count, and it means looking at those individual aspects of facial aging that have changed. I have done something called a Facelift Score app, which is really a series of short questions to help guide you whether you really need a facelift surgery, information that you should really know about, how to avoid certain risks and complications, and it takes only minutes to complete, and that may be something that's helpful for you. In summary, well, in terms of facial aging, the most important areas to treat are relative to gravity, laxity, and loss of volume. And then the key question is looking at the detail of each individual person's face, looking at the millimeters, because good surgery is both natural and discreet. I do hope this information has been helpful for you. Thank you so much for watching.